Many Democratic lawmakers and candidates are throwing their weight behind Medicare for all. Polls show it's a popular idea, at least among Democrats. Even among Americans identifying as Republican, 69% favor the ability for people under 65 years old to be able to at least choose to buy into Medicare. Could that be considered a version of Medicare for all too? If you ask 5 policy experts what Medicare for all actually means, you'll likely get 5 different answers. So when someone says they're for Medicare for all, what exactly are they backing? Over the next 2 weeks, we're going to be talking about this topic in our third deep dive into health policy issues, especially those that touch on social determinants of health and health equity, thanks to the support of the Robert Wood Johnson Foundation. This week, we'll discuss the possibilities, and then next week, the specifics of the many Medicare for all plans that are currently out there. That's the topic of this special 2-part series of Healthcare Triage. Nearly everyone agrees that Medicare for all entails an expansion of health insurance that's regulated and at least partially financed by the government. Some, of course, believe it's more. But at least by that definition, many proposals that aren't formally called Medicare for all are similar in spirit to those that are. Each of these plans differs in one way or another from the rest. Some, like Senator Bernie Sanders' bill, would create a single health care plan for all U.S. residents. Others, like Senator Deborah Stabenow's Medicare at 50 Act, would expand Medicare eligibility, but not to everyone. Still others would make Medicare or Medicaid a health care insurance option for many more Americans without necessarily eliminating all other private coverage. One way to find out which features people would actually prefer is to break down their proposals into their various components. Collectively, they vary in at least 5 major ways, and they're all worth discussing. 1. If enacted, some would result in universal coverage, others would not. Universal coverage generally means that virtually all residents have some form of public or private health insurance. This is the case in pretty much every developed country on Earth except the United States, where between 10 and 14%, depending on the survey, of the population is uninsured, down from a high of about 18% before the Affordable Care Act's coverage expansion in 2014. One of the main points of a Medicare for all, or similar plan, is to increase coverage dramatically, if not make it universal. Eradicating uninsurance is the goal, not the byproduct. Some plans, including that offered by Senator Sanders, as well as the Medicare for America Act, backed by Representatives Rosa DeLauro and Jan Schakowsky, would provide universal coverage. Others, like the Urban Institute's Healthy America program, would not necessarily do so. Lots of experts think that any Medicare for all plan should be universal and include everyone. But one person's universal can differ from another's. Does it include undocumented immigrants? Can people have the right to opt out? There are downsides too. You'll remember that there are always trade-offs. If we increase access through universality, we can expect an increase in costs. 2. Some would do away with employer-based private coverage, while others would keep it. Most non-elderly adults get health insurance through their job or that of a working family member. Some proposals would eliminate this source of coverage, although most would retain it as an option for large employers. One disadvantage of coverage through work is that it can cause some people to retain jobs they don't want just for the coverage. One advantage is that private coverage can offer benefits that public plans like Medicare don't. Many other countries, even those with universal public coverage like Canada and England, also allow employers to offer additional coverage. Lots of people believe that doing away with employer-based coverage completely is unlikely, if not undesirable. Americans seem to really like the idea of choice, even when it comes to insurance. Many employers would fight this as well, especially those with high-wage employees. Others think that we need to scrap the system entirely and give everyone the same insurance. 3. Some would supplant individually purchased private coverage, like that available on Affordable Care Act marketplaces or by Medicare Advantage. Some wouldn't. One of the main objectives of the Affordable Care Act was to help people who didn't qualify for public programs and could not obtain employer-based coverage to do so on their own through the individual market. In addition, Medicare itself has an individual market through Medicare Advantage, private plans that serve as alternatives to the public traditional Medicare program. Most of the Medicare for all plans would retain an individual market in some form, though a few would do away with it. There are reasons to consider keeping the individual market. It can spur innovation to meet beneficiaries' needs and can improve quality. Of course, there are individual markets and there are individual markets. The Affordable Care Act marketplaces are really different from Medicare Advantage, even though both are individual markets. Some believe the former have issues because they are somewhat underfunded. Medicare Advantage, on the other hand, has generous subsidies and provides a much better experience. It's also backstopped by a public plan, traditional Medicare, which the ACA exchanges lack. Some Medicare for All plans would still allow private plans to exist, like with Medicare Advantage, but some would eliminate them entirely. 4. Some would require premiums, while others would be fully tax financed. In the United States, we're accustomed to paying at least some of the premium of a health insurance plan, though some people on Medicaid or with an ACA marketplace coverage pay none. In addition, most coverage in the United States includes some form of subsidy financed by taxpayers. Most coverage expansion plans would retain premiums, though with subsidies for low-income families. However, a few, including Senator Sanders' Medicare for All bill, would do away with premiums entirely. Many argue for a fully tax-financed system. Under such an approach, everyone could be automatically covered without worrying about whether they can or did pay their premium. Just taxing everyone is more efficient as well. But many acknowledge that financing the system entirely through taxes would make many blanch. It would also nearly double what the government now takes in terms of income taxes. The taxes and spending would be about 60% of the entire U.S. federal budget. 5. Finally, while some would offer coverage with no cost sharing, others would have co-payments, co-insurance, and deductibles. In addition to premiums, most Americans are accustomed to paying for some of the healthcare we use through deductibles and co-payments. High deductibles in ACA plans have become one of the biggest sources of criticism and are a reason why many feel the coverage provided is unaffordable. Some coverage expansion proposals would eliminate cost sharing, while most would retain it. We've discussed the upsides and downsides of cost sharing in a number of healthcare triage episodes. They can be a powerful tool to reduce healthcare spending, but they also result in some people going without necessary care. There are ways to improve cost sharing by removing it for people with chronic conditions or moving to value-based insurance design, but few plans are headed in that direction. They either have cost sharing or they don't. Now that we've laid the ground rules, what are the plans? We'll be discussing that in next week's Healthcare Triage. Hey, do you like the show? It really helps if you like the video and really if you subscribe right down there. And another good way to support the show is at patreon.com. Go to patreon.com/healthcaretriage. We'd especially like to thank our research associate Joe Sevitz and our Surgeon Admiral Sam. And if you love Healthcare Triage content, get even more at the Healthcare Triage podcast. It's great. Get it at iTunes or Spotify or wherever you download your podcast content.